Want to see a no prep veneer smile makeover? Let's get right into it. Hey guys, Smile Doc here. Welcome back to my channel. Thank you for being here. Please always like, share, follow, leave comments. Love to hear from you guys. We're going to be covering a no prep veneer case today. There's a lot of things, a lot of stuff on TikTok and Instagram about veneers and having to prep the tooth. I mean, patients come in all the time and they're like, "You're going to shave my teeth down like baby shark teeth," that I've seen on Google, okay? It's just not necessary anymore. And this isn't a course on no prep veneers, but I'm going to walk you through a case on how you do them, okay? The first thing is very, very important. Most cases are not no prep. No prep means zero prep, okay? I'd like to say that they're prep less, but a lot of people think prepless means zero prep. I would say that these are minimal prep, okay? Almost all no prep cases are what I would call minimal prep cases. That means if you've got a tooth that's a little bit out of alignment, you got to polish it just a little bit. If you've got sharp spots on the edges, you've got to smooth those out because glass is porcelain and porcelain does not like sharp things. They like round, soft, smooth things, okay? So let's get right into this case. This is a before. All right, so it all starts with the consultation. The patient will ask you, "Hey, I'd like to know more about veneers." And then you start thinking, "Okay, let's talk. Tell me what your goals are." And so then you start assessing whether or not the patient is a candidate for minimal prep veneers or not. During the consult, you're going to be assessing whether or not they're a candidate. Then you have to have an exam. You'll move into the treatment room. You'll get the x-rays to make sure the teeth and the gums are healthy. And you're going to determine at that point if they are a candidate for a minimal prep, traditional prep, or a hybrid case, okay? In this case, this patient is a minimal prep case. And so we start analyzing through close-up, excellent photography, what needs to be done on the teeth. In this particular case, we'll start looking at her smile. We're going to speak very generically, but we do a smile exam, okay? During the smile exam, we're analyzing the bite, where we may have to prep or not prep. What kind of embrasures do they have? Any black triangles at the gum line? Are the gums symmetric or not? How's the bite plane, the entire bite plane relative to the skull? You're looking at all of these things, the health of the teeth, the health of the gums, to determine if you can move forward. And then lastly, you're going to want to pick a smile style. You're going to want to talk with the patient about it. You'll show them a chart. This is only one of them. There are many different smile styles that they can choose from. They could even bring in a picture if they said, "I love Halle Berry's smile. If I can see it close up, the edges, if I can see everything clear, me and the ceramist can reproduce that smile for you, okay? Now, in this particular case, she's got some chips on the edges of the teeth. We have to smooth those. She's got composite on that one central that we're going to have to remove. It's going to seem like it's more of a traditional prep, but it isn't, okay? It's still minimal prep. She's got a lot of old composite on it we're going to take off. Also, she's got some gum asymmetries that we want to talk about, and we have to level those up. She will have to get numb for the gum symmetry, okay? She will have to get numb for the gum work that's going to level those up. But after that, this is a minimal prep, no anesthesia case. First thing we do is we get her numb and we do the lasering of the gums to get them a little more level. A couple of days, that's when we do our scans. We use CEREC and we scan the teeth, and we're going to do this for the wax up, okay? The wax up is basically a mock-up of her teeth on a model with the smile style that she chose. Now, about 3 weeks later, she comes back in, and with no anesthesia, we do the minimal preparations that we need. We smooth those teeth out, and we get her ready for our final scan. We do the final scan that we'll take, which is we'll produce the model that the veneers are made off of, and we'll do her provisionalization or her temporaries. So as you can see, we use Luxatemp in this, and we make her temporaries very carefully. And we also spend a lot of time afterwards trimming them up a lot, making them smoother, adjusting the bite, because this is actually her try-in smile, okay? This is what she's going to be eating with for the next few weeks, and she's going to be smiling with. This is the moment where I get to evaluate the bite in a different way with the temporaries. I get to evaluate the shape, angles of everything, make sure everything looks like it's going to function well and it's going to look well. The patient gets to determine all of the little things. She gets to determine, "Oh, I thought I would like these canines sharp or round, and I want to change that. They're too long. They're a little too short. The shade, is it too bright? Is it too dim, too yellow? We get to make all those adjustments, okay, while she's in temporaries. Once I've determined that clinically we're ready to move forward, and once she is determined functionally and aesthetically she's ready to move forward, we do a bunch of more photos and we do a scan of the temporaries right in the mouth, and the ceramist that I work with will then make her final veneers off of this model, okay? So about 3 weeks later, she is ready for the final cementation of these veneers, and she'll come in. Again, no anesthesia. We very carefully take off these temporaries that she's had on for a while. We get the temporary material off, everything cleaned up really, really good. And we do our try-in, our final try-in, where we take the veneers, we're placing them on the teeth, making sure that they look good, making sure that they fit good, and we'll give the patient a mirror. Patient will look and say, yep, that's exactly what I thought I was getting, right color. And so then we move forward with the bonding process. We etch the teeth, do the bonding procedure that we do. We slowly bond on each of these teeth in a very methodical way. We get them nice and sealed up really well. We get the cement cleaned off really good. We get the bite adjustment. We get the lingual surfaces smoothed up really well. We get these veneers bonded on really well. I don't know if you can tell, but she has a small black triangle right here between the front two teeth with her finals. If everything is planned really well, that gum and that papilla is going to bounce right back into there, no problem. And at this point, she'll get her first look at her final veneers. That is how we go from her before to her afters. Please ask me some questions below. I'm happy to answer them, but that is the smile makeover with no prep or minimal prep veneers. I hope you've enjoyed it. Please like, share, and follow. Again, looking forward to seeing you on our next video. Smile Doc out.